Hello, Uganda. My name is Mwanguzi Shadrack, your doctor from Health Torch Uganda. And today, as part of the Hepatitis B Awareness Week at Health Torch Uganda, I'm going to be talking about what hepatitis B is, what causes hepatitis B. I'll talk about how you acquire hepatitis B, and I also talk about some of the people that are at risk or at an increased risk of acquiring hepatitis B. Hepatitis B is an infection of the liver caused by a virus, and this virus is called hepatitis B. There are many types of hepatitis viruses. For example, we have hepatitis A, we have the hepatitis B which we are talking about, we have hepatitis C, D, we have hepatitis E. Hepatitis B and C have a tendency of affecting an individual for even a longer time, or what we call the chronic form of the infection, as opposed to other forms which may only come and within a short time, even without treatment, someone is fine. And it's highly contagious. When I talk about contagious, I mean it has a very high rate or ability to spread from one person to another. That is hepatitis B infection. How do we get hepatitis B? First of all, before I tackle that, there are two forms. It can be chronic or it can be acute. Acute, I said, the symptoms appear very fast, as opposed to chronic, where you may become infected but then you take a very long time without presenting with any symptoms. Usually in adults, when an adult is infected with hepatitis B, they will present with symptoms very fast, as opposed to infants who get it from their mothers. Those ones rarely present with acute symptoms. They will go unnoticed and symptoms will come later on, and that's what we call chronic hepatitis. But someone can still have acute hepatitis B and then it goes on to become chronic. How do I get this virus in my body? It is transmitted through blood, infected blood, or body fluids. Not all body fluids. For example, there is evidence of this virus being present in saliva, but there is no evidence of transmission through saliva. For example, sharing of utensils like forks, spoons, or kissing carries no risk of acquiring hepatitis B. Coughing, sneezing, sweat, you will not get it. But there are other body fluids, like the fluids in the abdomen, the fluids in the chest, which may have the virus, and when you get in contact with them, you will get, or your chances of becoming infected will be high. Then people who get needle pricks can get hepatitis B if that needle was infected. Sharing razor blades and other sharp objects with infected people, you can get hepatitis B. Then sex, it can be transmitted through sex, any form of sex. It can be oral, it can be vaginal, it can be anal. You will get hepatitis B. There is what we call vertical transmission. With vertical transmission, I mean a mother who is infected transmitting to the baby inside. That's vertical transmission. So a baby can get hepatitis B in the abdomen or in the uterus from the mother who is infected. And who is at risk? There are special groups of people who are at risk of becoming infected. Health workers, they top the list. because they are in settings where there are a number of patients, some of which have hepatitis B, and because of some processes that take place in the hospital, they expose the patient blood, body fluid products, they are exposed to sharp objects. So health workers are at a very high risk of becoming infected. And then we have intravenous drug users, people who abuse certain drugs and they inject themselves. Sometimes they have a tendency of sharing these needles and blood products, which puts them at a risk of becoming infected. People who travel to endemic places I mean those places where the prevalence or there are very many people with hepatitis B. So when you go to such a place, the risk is increased. Patients or people with diabetes and are elderly above the age of 60 at a greater risk. People with chronic liver disease. Chronic, I said, means an illness which you have for a longer period of time. So if you have a liver disease which is for a longer period of time, it increases your chances of becoming infected. Then if you have kidney diseases, it also increases your risk of acquiring hepatitis B. So in a nutshell, I've said hepatitis B is an infection of the liver caused by a virus, hepatitis B. You get it when you get in contact with blood, infected blood, or infected body fluids, certain body fluids, and your risk may be increased if you have liver disease, a kidney disease, if you travel to an endemic place where there are a lot of cases of hepatitis B, when you are an intravenous drug user, men who have sex with men, and then health workers. So catch you in our next episode where we shall be talking about hepatitis B in terms of signs and symptoms, the things you feel in your body and should point towards hepatitis B, and then we shall also talk about what they do in the hospital that makes them know that you have hepatitis B. In other episodes, we shall also cover some of the treatment modalities. We shall talk about how you can prevent hepatitis B, and especially we shall emphasize the issue of the vaccination. So like our videos, subscribe to the channel, share with a friend so they don't miss out in this special week where we are spreading awareness about hepatitis B at Health Torch Uganda. Mwaguzi Shadrach, Health Torch Uganda, follow the light.